Hi. You would agree that the commonest side effect of minoxidil is increased facial hair. However, everybody with bountiful facial hair may not be taking oral minoxidil. He may also be in a lockdown. So today we're going to discuss about oral minoxidil, which is quite popular. A lot of inquiries about oral minoxidil nowadays. Increasingly, we have seen that people are losing faith in pharmacological research papers. Why? Because especially in the field of hair loss, where life and death is not a concern, increasingly we find companies which are gung-ho about the goodness of their product. And there are so many papers we find with questionable results and questionable conclusions which seem to be promoting a particular drug used in hair loss. So patients today do not have much faith left in these research papers, nor do they have trust in FDA, because FDA has been approving so many drug treatments which over a period of time have been found to be baseless. The only thing that patients research today is to find a doctor whom they can trust and who can guide them in the correct path, whether to take this drug or to take the other drug, because we all know one drug does not suit every situation. Every drug regime, every protocol has to be custom cut, tailored to a patient's requirement. I was not very well aware of oral minoxidil till one day a patient online asked me, I have been experimenting with oral minoxidil. Since oral minoxidil is a prescription drug, I have been drinking 0.1 ml of 5% minoxidil topical solution twice every day. Doctor, do you think I should increase this dose? Now, that got me thinking, because I had not had much information about oral minoxidil because we had not been using oral minoxidil till then. This is the extent to which patients can go in hair loss, because hair loss means a lot to patients. Patients have been experimenting on their own without advice of a proper doctor. So patients experiment with drugs, which is not a good thing. Just about 6 or 7 months back, we heard about the Spanish pediatric hospital incident where 5 young children were accidentally given oral minoxidil in place of some other drug for a stomach problem. And when it was realized that they were being given oral minoxidil for a long time, the patients had developed the so-called Viawolf Syndrome, that is hypertrichosis, as you can see in this video. It has been 7 months since it was discovered, the drug has been stopped, and now hopefully the children are returning back to normal. Why does a patient want to use oral minoxidil? Why? Because the patient, sometimes he cannot tolerate the medicine. The medicine gives its side effects of itching, flakiness, and reddish discoloration, and pimples. Sometimes his upper lid itches a lot, or the medicine gives you headaches, dizziness, fainting spells. Thirdly, the medicine might not work at all. There's no response to the medicine as far as hair loss is concerned for a long period of time that he's been taking it, and he's expecting a result and he's not getting it. So he wants to switch over to oral minoxidil because he's read a lot about it on the forums, and a lot of people on social media have been talking about it. So he wants to experiment with this drug instead, especially because he's also not taking finasteride. So this is worrying him no end. So minoxidil, which was initially started for recalcitrant or obstinate hypertension and is available in 2.5 and 10 milligram tablet, was used only for severe forms of hypertension, only when a lot of combinations, a lot of antihypertensives were used and they were of no effect. The use of minoxidil in hair loss was discovered because of the side effect that people noticed on patients who were taking minoxidil for a long time for hypertension. Oral minoxidil is metabolized in the liver. It is excreted from the kidneys. Its duration of action, that is vasodilatory properties, lasts for 72 hours. So it is advised that this drug by doctors should not be prescribed wantonly. Only those patients who are not having an effect, who are intolerant to finasteride and minoxidil, and this is verifiable, should be offered this drug as a last resort. And when this drug is started, it should be only started in low doses and increased to maximum up to 5 milligram once a day, or at the most 5 milligram twice a day. But when these higher doses are used, the patient should be subjected to frequent counseling and frequent cardiovascular review. So my impression about oral minoxidil has been through 3 sources. The first source is Dr. Rodney Sinclair's paper on oral minoxidil of 2017. Secondly, my informal discussion with Dr. Damkung Pithamvich of Thailand, who has an experience of over 25 to 30 years in using this drug, and that too in high dosages of up to 5 milligrams a day. So I discussed somewhere in 2018 in an ISHRS conference, and he told me that he has been seeing that patients, usually young patients who are otherwise not having any concomitant health problem, have tolerated this medicine without any concern. He has also not been doing any cardiovascular assessment, and he says that the patients grew hair much better than the topical solution, especially in the crown area. He does not prescribe any diuretic or a beta blocker along with oral minoxidil. But the dosage should not be exceeded. It's very important that the dosage, there should be cap on the upper level, on the upper limit of the dosage, that is 5 milligrams, at the most 5 milligrams twice a day under supervision. Why? Because the side effects can be very drastic. They're very dangerous. And the side effects are angina, pericarditis, pericardial effusion, hypertrichosis, pulsating headaches, intensely itchy eyes, severe rash on the body, and polymenorrhea in women. However, this said, I was once counseling a patient and he said to me that, doctor, you're talking about these side effects. Every single day of the year, when I stand in front of my mirror, I have palpitations and I think I'm going to have a heart attack. So doctor, please don't tell me about side effects. I am desperate. So this is the effect that hair loss has on patients. But all the more reason that you have to be careful, because patient who's desperate might try any dosage of minoxidil to suit his purpose. And experimentation with drugs can be fatal. Every drug has a side effect, we all know. Even an innocuous drug like aspirin can, in the rare circumstance, cause death by Reye's syndrome. You can have a bleeding disorder, which you can never recover from. No doctor is willing to give a prescription for oral minoxidil. So this could be partly explained by the litigious environment that we live in, and a doctor doesn't want to add to his liabilities by giving a prescription to a patient for oral minoxidil, which is not an approved drug, least of all FDA approved. Some patients have been taking up to 10 to 20 milligram a day, which is worrisome. Whether patients have side effects or not, we don't know. If something has happened, they are lost to follow up. Hair loss is least concerning the patient when he lands up in a problem. In keeping with Dr. Rodney Sinclair's paper on use of oral minoxidil, keeping that in the background, I myself am comfortable only with 0.625 milligram taken once a day to start with and raised to twice a day, and that comes to about 1.25 milligram in a day. 1.25 milligram dosage in a day, I think, is relatively risk-free and will give good results if combined with DHT blocker. I do not subscribe to the idea of increasing the dosage any further. Since this is a cosmetic surgery field that we are in, it is zero error field, and we should be very cautious while prescribing medicines to patients, especially a medicine which is not an approved medicine. The dose of minoxidil that is used in hypertension is as high as 10 to 40 milligram per day. Literature also says that it can be used to up to 100 milligram in a day, which I think is ludicrous because of the immense side effects of oral minoxidil, and it is ridiculous to be using 100 milligrams per day. But when patients come to you and say, Doc, I searched on Google, you can take oral minoxidil up to 100 milligrams a day, believe me, it is very frustrating. And patients of hair loss are so frustrated after other medicines have failed that they are ready to try anything. And that is the time you need to counsel them no end into the correct form of treatment and what to expect and how to stay away from high dosages of oral minoxidil. It is a very dangerous drug. So while you're on a little higher dose of minoxidil, say 5 milligram in a day or sometimes twice a day, you have to be very careful that there are certain restrictions which should be in place. One is that your salt intake should be low. Decrease the alcohol consumption. You may have to take a beta blocker if you're in a high dose of oral minoxidil, or a diuretic. This will be decided by your physician who is treating you for hair loss. You need to decrease the caffeine products, and all medications over the counter like cold tablets have to be avoided or taken in a minimal dose. You have to visit your physician quite frequently if you're in a high dose of oral minoxidil for him to check up your cardiovascular status. So these are important points to note. And thank you for watching. I hope I've been able to answer your question. If there is still any question, you can drop me a mail at drbhatti@darlingbuds.com and I'll be very happy to answer. Or you can WhatsApp us or call us at 981-453-1111. If you don't want to do any of these, just drop a comment in this video itself and I'll reply back to you at the earliest. See you in the next video. Thank you for watching.